These are our experts, and I'll introduce you guys. Y'all can walk up and grab a seat. So Ben Cook is a licensed therapist in private practice in Nashville, the owner of Third Gear Counseling, provided training for Vanderbilt School of Medicine, and worked as an adjunct instructor at Wake Forest, and has a special expertise in substance abuse. Catherine Fowler is founder and owner of Fowler Nutrition and has been in practice for 16 years. She is the board chair of Renewed Eating Disorder Support, which is a nonprofit that provides free professional and confidential referrals. And we'll hear more about that later. So Jennifer Newman, is it Gowski?
Gajewski.
Okay, Gajewski. Okay, she's a child and adolescent and adult psychiatrist and is the owner of Comprehensive Family Psychiatry. And she has a specific expertise and interest in helping students navigate the complex transition from adolescence to adulthood. Dr. Amy Mariuskin is a clinical psychologist and owner of Nashville OCD and Anxiety Treatment Center. She is also adjunct faculty at Vanderbilt and the author of a book, Thriving in Relationships When You Have OCD. Dr. Betsy Triggs is a pediatrician with 40 years of experience with a special interest in behavior development and adolescent medicine. She's a mother of 2 and grandmother of 4. Dr. Dana Verna is a child and adolescent and adult psychiatrist, also the co-founder and medical director of Green Hills Family Psych, and is a mother of 4, Nashville native, alumnus of Harpeth Hall. And Brandy Wade is a licensed professional counselor in private practice called Inner Beauty Wellness and a program manager with the Tennessee Department of Mental Health and Substance Abuse Services. She's currently pursuing a PhD and has been a great resource to me at helping me figure out what's here in Nashville and how I can integrate the Goldfinch Foundation to Nashville. So I think we'll stop and address questions. So I have, if anyone's written down questions on the white card, we can pick them up. If you have a question you want to ask our panel, I also have questions too if we don't have anybody to take the first stab. Actually, why don't we do this? So why don't, to break the ice, why don't we have each person, Ben, we'll start with you, tell us the biggest myth that you hear in your clinical practice from your patients.
I would say probably the biggest myth that I hear, especially if it's relating to substance use, is my parents are overreacting about weed, or weed is all natural and so it's not that big of a deal. And when it comes to alcohol, that blacking out is not that big of a deal because everybody does it, and again, you don't need to worry about me.
Okay. I think one myth is that to go and use college counseling, you have to have some sort of like severe mental health condition or something diagnosable. And that's a myth because anybody can take advantage of it.
Kind of piggybacking on that, as a psychiatrist, what I hear a lot from my patients is, I just don't think I need my medicine anymore at college. That was like the old me, I'm gonna figure it out at college. And same for accommodations, so extra time or help with note taking. A lot of kids will say, well, I just want to see how it goes, and I think I'll be all right without it. But that's sort of like leaving behind all the tools that helped you get to the place you are. So you want to definitely keep your good momentum that got you to where you are going at college.
I would say for me, the biggest myth, like my experience, I'd say it's not that I don't think you will find your forever friends in college, but I think how quickly the Instagrams and highlight reels that people put all over their social media that like captivates our generation makes it seem like people are like that like all the time. And I have a number of people from my hometown who I know who are posting all over Instagram first semester, and next semester that I see that they're transferring or going somewhere else. So I think just this idea that like you find your forever friends right away, you'll figure out who you're going to be, and that all that happens really quickly.
I would say there's a huge pressure in college to learn to become the word independent, and a lot of people think independent means do everything perfect all the time. That's what an adult does. But as you transition to becoming an adult, I'm sure all your parents will tell you, measure of a healthy adult is someone who knows when they don't know, right? When they know they need someone's help to solve a problem, they need someone's help to help someone in their life or help themselves. A real adult knows when to ask for help, and that's what college is about.
As a dietitian, I would say one of the common myths that I hear from young adults embarking on college is just they've stopped growing, they're 18, and therefore their body shouldn't change, and that their demands and their needs are going to stay the same. And that is certainly not true. Lots of transition is going on that time, in that time period. There's continued growth and development, and our bodies change throughout the life cycle, and so do our needs.
I think the biggest myth I would hear is that if you're not okay and having a great time in college, there's something wrong with you. It's okay to not be okay. And please call someone. You can call your pediatrician. In many cases, you all are lucky you've had pediatricians since you were little. We have known you since you were learning to walk, or learning to read, or learning to drive and driving your parents crazy. So call us. It's confidential. Many of us have portals. Text us, even at 3 in the morning. We'll get back to you.
One of the biggest myths that I find in my practice, working with a lot of anxiety and depression, is that everyone around me has everything together and I'm the only one struggling. Many times they're struggling with identity issues and healthy relationships. Who's my friend? Who's not my friend? So they're not as quickly to go ask for help or really express those vulnerable moments because they feel like everyone around them have them together. And I'm here to say we all are working on trying to get it together no matter what age you are.
I don't know how I'm going to top all these great things, but I would say as a psychiatrist, what I hear often from college students, especially with the transition freshman year, is that seeking help is a sign of weakness. So like in line with trying to be more independent as they transition to college, they think maybe they can manage and without medications or like Dr. Burns said, without accommodations, and they may try to stop their meds on their own or not engage in therapy as much as before. And I think with all those transitions, sometimes that it can be when it's most helpful to consider continuation, just depending on what's going on. And your friendly psychiatrist is always here to help sort of talk about that option with you.